Spondylolysis. Spondylolysis. Spondylolysis is common in L5 vertebra. Spondylolysis is common in L5 vertebra. What is called a spondylolysis? If you look into the vertebra from the lateral side, vertebra has got a body like this. It has got a pedicle like this. From the pedicle, you got superior articular process and a inferior articular process. Lamina and the spinous process will come like this. When you look at the vertebra from the lateral side, a vertebra will have features like this, lumbar vertebra especially. So this is called as superior articular process. We'll put the spinous process nicely, nice and big, because in lumbar vertebra the spinous process will be like this. Okay. So there will be superior articular process. This is inferior articular process, and this is spinous process, and this is spinous process. So when you look at the vertebra from the lateral side, a vertebra will have these features. This is called as pedicle, and this is the vertebral body, and this is the vertebral body. The part between the two superior processes, that is the part between the two articular processes, is called as pars interarticularis. This is called as pars interarticularis. Pars interarticularis. Okay. So to repeat, so this is the vertebral body. From the vertebral body, you get a structure called as pedicle. From the pedicle, you have a process projecting above, which is called a superior articular process. You get a process projecting below, which is called as inferior articular process. These two are connected in the region called as pars interarticularis. The pars interarticularis, you have another bone projecting here. This is called as transverse process. This is called as transverse process. And what is seen behind is the spinous process. So these are the parts of the vertebra when you see from the lateral aspect. And if you see very closely, okay, if you see very closely, it looks like a dog. It looks like a dog when you see from the lateral side. So this appearance is called as Scottish dog appearance. This appearance is called as Scottish dog appearance. This appearance is called a Scottish dog appearance. You should imagine only, I didn't draw it properly. You should imagine. So this looks like a dog with eye there. So it is called a Scottish dog appearance. Now what is called a spondylolysis? Spondylolysis is fracture of pars interarticularis. So spondylolysis is fracture of pars interarticularis. This is the region which we call as pars interarticularis. If a fracture appears there, then it is called as fracture of, it is called as spondylolysis. So in spondylolysis, the sign we are getting is Scottish dog wearing collar appearance. Scottish dog wearing collar appearance. So Scottish dog wearing collar appearance you are getting. Okay. So this is called as spondylolysis. So what is spondylolysis? Fracture of pars interarticularis is called as spondylolysis. Normally, when you look at the vertebra from the lateral side, it gives a Scottish dog appearance. When there is a fracture, it is like a dog wearing a collar appearance. So it is Scottish dog wearing collar appearance. Okay. So what is called as spondylolisthesis? What is called as spondylolisthesis? When such a kind of fracture happens, vertebra slips over one another. Vertebra slips over one another. Superior spinous process, inferior articular process, superior articular process, inferior articular process, and spinous process. Now if you see the vertebrae, this vertebra is slipping over this vertebra. Okay, the one vertebra is slipping over the other vertebra because of the fracture in the pars interarticularis region. When the pars interarticularis region gets fractured, the vertebra slips over one another. This slipping is called as spondylolisthesis. This slipping is called as spondylolisthesis. Listhesis means slippage. Listhesis means slippage. So slippage of one vertebra over other is called as spondylolisthesis, and it mostly happens in L5-S1 junction, and it most commonly happens at L5-S1 junction. In spondylolisthesis, you get V-headed Scottish dog appearance. V-headed Scottish dog appearance. You get V-headed Scottish dog appearance. Because of the slip, this part moves anteriorly. It looks like a dog head has been cut off. So this is called a Scottish dog or V-headed Scottish dog appearance. So three things you have to remember here. Appearances in X-rays. One is Scottish dog appearance, Scottish dog collar appearance, and V-headed Scottish dog appearance. They are diagnostic of spondylolysis and spondylolisthesis. The diagnostic of spondylolysis and spondylolisthesis. And now with this background, we'll move to the next part of the spine. So when you look into the spine, spine has got three columns in it. Spine has got three columns in it. So there are certain ligaments here, anterior longitudinal ligament, posterior longitudinal ligament. You get certain structures here called as intervertebral disc. And there are also ligaments here called as interspinous ligaments and supraspinous ligament. Interspinous ligament and supraspinous ligament. Now, a person called as Dennis divide the spine into three columns. So this is called as three-column theory. This is called as three-column theory of spine. So how he divided? He divided the spine into three halves. This is the anterior column. This is the middle column, and this is the posterior column. So he divided the spine into three columns. One is anterior column, this is middle column, and this is posterior column, and this is posterior column. When a fracture occurs only in the anterior column, when a fracture occurs only in the anterior column, it causes wedge compression type of fracture. It appears like a wedge compression type of fracture. When the fracture involves both the anterior and middle column, it is called as burst fracture. It is called as burst fracture. It is called as burst fracture. When a fracture occurs across all the three columns, example of that is chance fracture, which occurs in the RTA accidents when the patient wears a seat belt, so they are called as seat belt fractures. Seat belt fractures called as chance fracture. Okay, when more than two columns, or when middle column is involved, then that fractures are unstable fractures. When more than two columns or only middle column is fractured, then those fractures are called as unstable fractures. So you have to understand this basic concept that spine is divided into three columns: anterior column, middle column, and posterior column. Okay.